My name is Neil Tanna. I am a plastic surgeon in New York. I'm part of a large health system called Northwell Health. We're based out of New York, and I specialize in um, breast reconstructive surgery. So I take care of women who have breast cancer, who are undergoing breast cancer surgery and reconstructive surgery. And I also take care of women like yourself who are considering to do, preventative or risk reduction surgery because of family history or gene mutations and want to consider, doing reconstructive surgery at the same time. So, that's sort of my life's work, my research, my passion. It's what keeps me up at night. It's what drives me to innovate. So anything that I can do to help, you know, is appreciated. So this is a dynamic situation. It's evolving, and probably at the core of it is that we don't know a lot of the information, and all of us are in the same boat. An hour from now, a day from now, and a week from now, this conversation could be very different, because we're just learning as we go forward. Don't get caught up in the hype or the hysteria. Follow the facts and listen to credible sources. This is a virus, and currently we have no good treatment or vaccine. So there's no way to really prevent this, and more so, there's no way to predict who's going to get this. One step further, when you look at people who get it, there's no way to predict how severe the symptoms are going to be. So that's a lot of unknowns that I've put there. So we're basically telling people to adhere to universal precautions. Basically, act as if anyone that you encounter could have it, or any situation that you're in, you could be exposed to it. I would tell all people right now is just to be vigilant, right? Be aware. And I think being aware is not only, looking at credible sources and keeping up to date on information because things are rapidly changing, but just be aware of yourself and how you are behaving, conducting, both for your own health and how you're interacting with others. And I think that awareness, we have to have an awareness. It doesn't mean that you can just lock yourself away and drop your guard. And then I would tell people that, who are in unique situations where they have ongoing health concerns or issues, like women with breast cancer, every case is different. And I'm sure we'll get into this, but every case is different. And you have to really have a good dialogue with your, treating physician as to what's the next steps, and that can be as simple as, am I coming in to see you in the office? Am I going to have this surgery? Am I going to continue this medication? Everything has to be weighed in terms of risks and cons, right? Okay, so let's break it down into two groups of people, kind of like what you said. So let's talk about patients who are truly elective. And when we say elective, we're not talking cosmetic. Even though it's an insurance-based procedure or something that's medically indicated, it's not an emergency. So let's talk about elective. So that could be your woman who's choosing to do a preventative mastectomy and reconstruction. That could also be a woman who's had previous breast surgery and wants a revisionary procedure, or a woman who had breast cancer, who had her mastectomies and wants a reconstruction revision or a reconstruction. So these are, you're not hard pressed to do it right now. And that's very simple. You postpone it. And the reality is that, you're going to postpone it for a few reasons. Number one is it in itself is it's behaving in social distancing, right? Because you're not congregating into one place. Number two is that, undergoing surgery, there are risks with surgeries. And then if you were to contract the virus, that could increase your risk of complications, right? Because you are now sick and you could sustain a complication if you were to get the virus. And then I think third is that it just comes down to a resource utilization issue. And so a patient who undergoes surgery is using a breathing tube, a ventilator, a nurse, a surgeon, and a anesthesiologist. And what we're seeing is that, these are going to become limited commodities and limited resources and really have to be utilized for the people that need it right now. And so if we can put that person off for now and keep them out of risk and out of the system, then we've done them a service. Now, the question becomes, what about the non-elective or the patients who have an active cancer? who need to have cancer-related surgery. That's where you got to really have a very specific dialogue with your surgeon or your oncologist or your physician, and maybe all of them. And you need to really have an honest discussion to say to them, what are my risks of delaying surgery or putting off surgery versus what are my risks of going in right now and having surgery and potentially contracting the virus or contracting it later, and what and developing a complication from that. But what you kind of have to draw out both scenarios, and you can't create a blanket statement saying all breast cancers have to be done or all breast cancers don't, because we know breast cancer, for example, varies, right? There's different stages and there's different aggressive levels, and so you have to look at each case individually, and that's what we're doing with our own patients. Don't assume that, okay, since this is my situation and I don't want to go into the hospital, I'm not going to go. Or on the flip side, you know what, I have the time now anyway, I'm on this quarantine, let me go in and have my surgery. Don't assume that either. You really, you have to really talk to your doctor, and I think any physician will sit down with you and say, okay, this is your course of action one way, and this is your course of action the other way, and really figure out what's going to be the best for you and put you at the least risk, because and every geographial area is also different right now. We're in New York, where it's, we're in the epicenter of this right now. So that may change for other areas, but, we were doing breast cancer surgeries without hesitation, weeks ago, and it changed dramatically. So that's my point, is this can change in geographic regions across the country as well. Yeah, so there's no question that if you're in treatment, you're at a higher risk. Chemotherapy is an immune suppressant, and what happens is our white blood cell count, which is a cell in our blood that's used to fight infection, keep us healthy, is decreased. And when you come off of chemo, it starts to come back up. The question is how far away from the chemo does it start to come up? And we don't really know that. So I'd be more comfortable, or an oncologist may be more comfortable telling you somebody who's 6 months or a year after chemo, should be fully recovered. But it's that gray area. Let's say somebody who's 4 weeks, 6 weeks, certainly they may still be immunocompromised, and really blood tests, that patients undergo, it can help you decide that. But I don't think that's a practical way to think about it. I think the better way is to say somebody who has, obviously somebody who is in chemo and somebody who's recently finished chemotherapy. Again, recently, no one can tell you exactly what that hard and fast number is, but with good judgment, someone who's recently finished chemotherapy, you are at a heightened risk of developing more severe manifestations of the virus. You are at a higher risk of pulmonary complications if you contract the virus. So for you, social distancing and hand washing and alcohol is even more important than it is for everyone else. But again, I've said that from the beginning, everyone should be engaging in this type of behavior. Yeah, you have to understand that treatment-related fatigue, could be, it all goes hand in hand, things from chemotherapy, fatigue, dry skin, brittle nails, immune compromise, a lot of it goes hand in hand. And so I would assume that, if you're still having some effects from the chemotherapy, that probably the immune system isn't too far behind. It all goes hand in hand. The reality is what happens if you contract it? Could you, if you have fresh incisions and you've got drains and you're recovering and things like that, could that increase the risk of complications? So your surgeon or your physician is going to be, okay, how quickly do I need to act? You have to understand that patient who's thinking, about my elective or preventative mastectomy, there is also risk of undergoing that surgery and
Right.
risk of undergoing it during this corona time. All the women out there that are, at home with their kids, I feel you, because, all the men and women, because it's tough. It's a big adjustment for everybody,